Hey everybody, my name is Melanie for those that are new here, and this is a post-surgery update. I've had a few people asking, and I know it's been a couple weeks since my surgery, but I've just been home healing and really haven't been on the computer or the phone or whatever to really have a chance to uh, update. We're also kind of waiting on a few things, but I am obviously home working on recovering. I am currently able to be home alone with the baby, and we're doing well with that. There are a few little hiccups, and I will get to that, but overall, I'm doing okay. It's been a little harder this time just because not harder, that's not the right word. It was way harder last time. Okay. So just a little catch up for those that may be watching this for the first time, don't know my story. I was diagnosed with cancer at 30 weeks pregnant. Had my baby. My cancer was in my left nasal cavity, but had extended into my eye orbit and up into not into my brain, but up towards my brain, and was impacting the dura, which is the lining of your brain. So it wasn't in my brain, but it was impacting my dura. So I had her early. She was spent 2 weeks in the NICU while I started chemo in the hospital. Thankfully, the majority of the tumor responded really well to chemo, the part that was taking up my left sinus cavity. It basically, like within the first chemo treatment, started to shrink. And by the time my last chemo was over, it was gone. But the problem was that the part that had gone into my eye orbit did not go away. That part of the tumor was still there because your eye orbit doesn't actually get a lot of blood flow, and chemo needs the blood flow to, like, I guess, get to it. I don't know. Either way, that part really didn't shrink down much at all, and I had to have my eye removed, as well as part of my skull they removed to be able to access the dura and kind of get the tumor down from there as well. The first surgery, they removed my eye and took a skin flap from my arm, which makes the flap a lot smaller. Unfortunately, after I had my surgery, I had radiation, which helped, clear out the rest of the cancer, but unfortunately it burned a hole in that skin flap. And it got to the point where I ended up having to have a second flap surgery basically completely redone, because the hole got so big that where they had taken my skull out, my dura was basically exposed. My dura was not exposed, but the amount of protection over my dura was not strong. And the risk of that is getting a CSF leak, which is CFS. Basically, it's a leak of your brain fluid, and which, if there's openings, it can lead to meningitis, all these things. So basically, they had to provide more protection to my dura, and I had to have another flap surgery. So the first surgery follow-up was a lot harder physically on my body because I had radiation, and the radiation wrecked me. This surgery, while the recovery is easier because I'm not going through radiation, it's been a little bit harder, kind of wanting to come on here and wanting to be out in public, because this is kind of what I have to do right now, or this is what I look like, which is, it's healing. There's no more hole. kind of. I'll get to that in a minute. But it is obviously a lot bigger for those that saw my last skin flap. This one is obviously a lot bigger. And so it's just a little hard to, it's a little hard to look at myself sometimes, to be honest. In my head, I look one way, and when I look at myself, I look another way. But, that's just the reality of where we are right now. It will shrink by about 50%, but it will never be as small as it was before. And then obviously this side of my mouth is still very impacted, the nerves in the left side of my face. So this is actually the best it's been. In a few weeks, it was a lot harder to talk well for a while, but now I'm talking well. It's moving. It's not like it was like really closed or like talking like this, but now it's gotten much better, and it will continue. The nerves over here will continue to get better, so that hopefully I can smile again without smiling like this. My husband came home from work the other day, and I thought I was smiling at him, and he was like, "Why'd you look at me like that?" And I was like, "I smiled at you." And he said, "Oh, no." I mean, he said, "Sure," but it was, looked like probably a lot more of a grimace, and he probably thought I was, I don't know, who knows what he thought, or why I thought what he thought I was thinking, because I was just trying to smile at him. But the nerves will get better. This will shrink down, but it's just been hard. Just been a little hard. We went to the beach the other day, and I had a slight panic attack because the wind was like blowing this up, and so there were people everywhere, and so far the majority of places I've been have only been like my medical appointments. That's the other reason I really haven't been able to get on here. I've just had a lot of appointments following up the surgery, and so while baby's napping, I am trying to rest, or I'm at an appointment and someone is watching her. But I feel okay going to medical places because, they obviously know something is medically wrong with me. But going out in public is just a little harder. And I know it'll get easier. I'm just going to have to do it. I did it. I got used to it with my other skin flap. But I was able to put just a cute little sticker patch over that, whereas this is not a cute little sticker patch. It is a weird bandana eye thing that covers half my face. So, it's just a lot. But surgery went as well as it possibly could. My surgeon did not want to do another surgery anywhere near this quickly because operating on radiated skin is really hard. Healing doesn't go the way they would ideally want it to because your skin is so compromised, which is why I had to have my eye removed prior to radiation originally. But this time they took the first one, they took the flap from here. It was much smaller. They take an artery with it. This time they took it from my thigh. And so I will show you that. It runs that's her shirt. It runs the entire length of my thigh. But at least I don't have to have like a patch of missing skin, because your thigh has enough skin and like has, just more movement than your arm. They do the whole incision, but then they take like a little circle of skin and then they're able to just close it over, and it's just a scar, a very long scar, but it's a scar. Excuse me. So I was in the hospital for a week, had drains in my leg, had a drain here, because what they did is they took muscle from my thigh and put it here, which is why it's so much bulkier than the first one, because the first one was fat and it's not as bulky. Muscle is a lot bulkier, and basically I have to wait for that muscle to atrophy in my face kind of before it's going to start shrinking down. When I first got out of surgery, this whole side of my nose is basically full of muscle, like it's like sitting right here. That will eventually shrink up, but right now I cannot breathe out of the left side of my face. Thankfully, I'm starting to be able to breathe out of my right nostril. That I wasn't able to do either because the muscle was kind of impacting that side as well, but it's already shrunk enough to where I'm able to breathe out of the right side, so that's good. But it's making my mouth really dry again because I'm breathing out of my mouth all the time. But, sorry, getting sidetracked. Surgery went as well as could be expected. I mean, thankfully the flap took, like, what they took the muscle as well as an artery from my thigh. This time they put the artery in. I have an incision that runs the length of my ear. They connected it to the old incision down here where they originally put the artery in to connect to the flap. This time they put the artery in here and it tunnels up this way instead of like their first one tunneled up from down here. This one's tunneling over from the side basically. But it took, which is good. So that part's good, but you can see this was the original skin flap. So that skin is much more compromised because it's radiated skin. And what happened after surgery right here is basically an area of my skin that opened up after surgery. I have another hole in my face, and that happened because the fluid in my face needs a way to escape. And there's a screw right here that either one is infected or two, it's just like the most compromised area of my skin, and so the fluid collects there and then eventually burrows a hole to release the fluid. Thankfully, it's already closing up, so that's a good sign, but you can kind of see right here another hole opened up because the stitches won't hold because of the radiated skin. So I was home on IV antibiotics for 2 weeks. I'm going to be on more antibiotics basically to suppress it if it is an infection, because if it is an infection, it can just keep happening. But we don't know. There's no way to know if that screw is infected unless it happens again, basically, because it's either infected, like I said, or it's just compromised skin, and until the skin heals more, it could keep happening. So, joy, more antibiotics, but I'm trying to just, again, be grateful that the skin flap took, that they also, when they did the surgery, they tested some of the areas around the eye, and those all came back negative for cancer, so I am still cancer-free. No signs of recurrence, so, thank God for that. Obviously, I'm still healing, like the stitches are still there. They're there, which is another reason I want to wear this. Once the stitches come out and it goes down a little bit more, I think I'll feel better wearing just a patch, but right now, that is if I can get a patch that'll fit it. Yeah, but I'm frustrated because obviously we knew that having radiated skin would be an issue. I just didn't expect it to be this big of an issue. I have more holes in my face. I'm so tired of having holes in my face. Like, if this hole opens up, I can still breathe out of my eye like I could before. And I just want to breathe out of my nose. That's all I want. I want to breathe out of my nose. So I'm looking forward to that day. And part of the other reason I was waiting to update was that I'm going to be starting hyperbaric oxygen. We're waiting for the insurance approval for that. And so as soon as I can start that, it'll help speed up the healing significantly. So please send vibes for that, prayers. It's going to mean more. It's every day, well, Monday through Friday for 2 hours a day. And I'm just so tired of having to be away from my baby and tired of appointments. And I know that this time it'll be much more healing. Last time I was having to be away from her every day for radiation, which just, like I said, wrecked me. Whereas this time I'm having to be away from her, and the hyperbaric oxygen is supposed to just really help your body in numerous ways, but it will help the healing. Hopefully close all of those holes, take down the inflammation more quickly, and hopefully allow me to breathe better. But it's 60 sessions, and I'm just like 60 more days of appointments, and I'm just so ready for them to be done. And I know it's just, I need to be patient. It's a process. I'm here. I'm grateful to be here with my baby, with my husband, with my friends and family. It's just a lot. And so I don't know what that'll look like once we start that. It'll be crazy. I don't know how often I'll be able to update after that, just because the times I update are during her nap. But I'm trying to schedule the hyperbaric oxygen for during her nap so that I'm not missing more time with her. And then that way it's easier on whoever's here watching her. So that's the biggest update for now. Surgery is over. We're home, doing as well as possible. So, like I said, grateful for that. Thank you for everyone. Thank you to everyone who has been checking in, sending prayers, sending vibes. We're very, very grateful. I will try and continue to keep things updated as the swelling goes down, as the stitches dissolve. There's a couple other things I want to share just that have been on my brain, but I just haven't had time to get on here and process them. But that's where we are. I'll try and do a live soon too, just because I feel like I rambled here and probably didn't answer all the questions people have. But the main one we've been getting is, how is healing going? And with the exception of the holes, it is going as well as possible. I'm mobile, I'm walking around, I'm able to lift her again, and I was not able to lift her for the first couple weeks. Thankfully, my husband was able to take off those first few weeks and was home with her and here to help me. But I'm able to be on my feet. I'm taking care of her, and that's the biggest thing. So I'm grateful for that. Just need to get these holes closed up, put some weight on, and really start just trying to get back to myself and get used to my next new appearance. So that's it. Thanks for like I said, checking in, being here. We really appreciate it. Bye, everybody.